Hi, my name is Matt Aitchison, and I'm the director of the Medical Surgical Unit here at Mary Greeley Medical Center. And I wanted to share with you today our brand new patient room. So come on, let's take a look. These patient rooms have been many years in design, and actually one of the things that you didn't know about this, or you might have not heard before, we actually went through 14 variations getting to this room, working with lots of staff to design a room that is both for our patient and focused for our patients, but at the same time meets the needs of staff to provide the best care possible for our patients. So we really break this room into 3 areas. The first room is that work area for our nurses and our medical staff. There's sinks, counters, areas for them to have the supplies stored that they need to prepare before they actually come to the patient's bedside. And as we step into the center area, of course, the center of the room and the center of our attention is our patient. So our focus is here on our patient and the patient bed and the patient's area. And we didn't want to leave out our families because we know families and loved ones are so important to the health and well-being of our patients. We actually have a third area where we look and focus on our patients' families. We actually have a couch that they could sleep in. It works as a recliner area here. We have a really enhanced sized windows. As we kind of come back over here into our patient area, one of the things I wanted to show you, which is a real neat feature, we have enhanced call light system. And actually, you see on this call light, that red button is pretty typical that you'd see to call the nurse. But we actually can specify what we want. If I'm the patient and I want water, I press water. And what that does for me is that's going to send a message to any person that could come and give me water. At the same time, if I have pain, I'm going to press that pain button, and that's going to go to my nurse, because my nurse is the person I need to address my pain. So that just helps us to enhance and actually get us to you quicker with the thing that you need as the patient. And the other thing I wanted to show you that it's a really neat feature, there's a few more things. One is, this is the work area within, next to the patient, where the nurse works. This is our computer system where we access the chart. But the nice thing is I can work on the chart and I can have eye-to-eye contact with you as the patient, focused on you. I'm very much within hand's reach of you at any time, or any equipment that I would need to get at to work with you or to help you. We have this really neat extra that was actually designed just specifically for our building. This wheels out, and this gives me as the nurse an extra work area where I can put medications and things as I'm getting prepared to administer those to you. And we have the scanner here because we use a safety system where we actually scan the patient and we'll scan the medication so that we know we're giving the correct medication to the correct patient at the correct time. Another nice feature too is when you look over here at my computer monitor, I can bring up things on my monitor. I can certainly look at x-rays as I'm looking at now, but I can also step over here and I can punch in a specific room number, and then all of a sudden you as the patient can see exactly what I'm seeing here. And this is going to be wonderful for our physicians, for educating their patients, helping keep you as the patient informed with what's happening with your care, also for us as the nursing staff, so we can help you to understand and know the things that you need to know to take care of yourself when you discharge from the hospital. Another exciting piece of technology that we've implemented with this new building is our patient lift system. We have several rooms in each area that are equipped with the patient lift, and you see that they hide behind this little closet here so you wouldn't even know they were here. But with my remote, I actually bring out the cassette, which is a patient lift, and I can bring this out over my patient, and we can use this as a way to help transfer a patient as we need to. So now we're going to move into the last section I want to show you, which is our bathrooms. And these bathrooms are amazing. We've increased the size immensely. We have a zero threshold floor that gradually slopes down in the showers, so we've avoided any of the issues with tripping or stumbling. The whole room themselves have a much larger radius to be able to move around. We have large doorways so that you can take a patient, help a patient into the bathroom with a person on either side and still have plenty of room. This is really going to enhance the way that we provide our care for our patients and help our patients to feel comfortable, and that's a very important part of this. And that concludes our tour of the inpatient rooms here in our expansion at Mary Greeley Medical Center.